A lot of people suffer the effects of COVID long after the initial illness. Long COVID is a condition that is complex and it can be debilitating. On social media, there are recommendations to try nicotine patches to treat the symptoms. Jonathan Jarry is with the McGill Office for Science and Society. Hi, Jonathan.
Hi.
So, Jonathan, the COVID pandemic is over, but the virus is still around. People still getting sick.
Yeah, even though the WHO declared the end of the pandemic in 2023, in that same announcement, it stated that it does not mean the disease is no longer a global threat. The best estimate I've seen right now is that 1 in 161 people in Canada is currently infected. That's from COVID-19 Resources Canada, in case people are curious. And we know that somewhere between 1 in 100 and 1 in 10 people who are infected with COVID will develop long-term health symptoms from it, and that is what we call long COVID.
So long COVID is real. Treating it, though, is difficult. Social media is suggesting, nicotine patches. Now, where does this come from?
So in April 2020, there's a team of researchers in Paris who noticed that smokers were underrepresented in patients hospitalized with COVID in China. So there were fewer of them than you would expect based on the percentage of smokers in China. And they came up with this theory that the coronavirus could bind a receptor at the surface of our cells that is typically used by a neurotransmitter, but also by nicotine, which is found in cigarettes. The idea was that nicotine could bind to it so strongly that the coronavirus couldn't, and thus nicotine would protect you from the disease, at least partially. Now, the scientists were not recommending that people take up smoking during the pandemic, but they did wonder if nicotine patches could be used to achieve this alleged protective effect.
Okay, so this was nicotine, the hypothesis. It didn't hold up the testing, though.
Not really. So you can use computer modeling to see if the coronavirus could, in theory, bind to these receptors. And the answer was yes, but it's a prediction, not a fact. And when this binding was tested for in highly artificial conditions in the laboratory, different teams got different answers. So I'm not convinced of it. And even more importantly, those early studies from China saying that we have fewer smokers than we expected, they were deeply flawed. So for example, they often didn't know if a patient was a smoker or not. So the calculations were done on a small fraction of patients. And also many people who had recently stopped smoking were classified as former smokers and not smokers. So it gave the impression that there were fewer smokers in hospital than there really were.
And interesting to note that the study saying smoking might protect people from COVID was funded by a tobacco company.
So not the study itself, but its star researcher, as reported by Le Monde. It turns out that in the 1990s, he received $220,000 in funding from the tobacco industry. So maybe that influences thinking a little bit during the pandemic, maybe.
The idea isn't without risks as well, though, Jonathan. Nicotine patches for people who don't smoke at all might actually be harmful.
So the good news is in studies of smokers who are quitting smoking using these patches, we don't see serious complications. They have also been studied in non-smokers for a number of conditions, including Parkinson's, and there too they appear to be safe. But, giant but, these studies did not test to see if people got addicted to them, which is important information that is missing. Now, because these patches deliver a slow, continuous dose of nicotine, they are thought to not be nearly as addictive as cigarettes, but we just don't really know for sure.
So at the end of it all, Jonathan, what do we know about long COVID?
We know that it's real. We know that it manifests in different ways in different people. We know that it is debilitating, and we know how to prevent it, which is to avoid getting infected by the coronavirus itself, and that means masking, preferably with an N95, KN95, KN94 type of mask at least. It means cleaning the air, and it means vaccination, and none of these guidelines have changed in the last few years.
Okay. Thank you very much for this, Jonathan.
Thank you for having me.